In 2007, I can still remember reading this story in the Washington Post of Diamante Driver. He was a 12-year-old boy who had had such significant bacterial infection that went to his brain that was caused by a tooth abscess. So he had oral health problems and suffered with them for a long time before anybody recognized how severely sick he was. So the systems weren't there for that child. The opportunities weren't there to relieve his suffering. And from the tragedy of his death came an opportunity for change in Congress, where they started to see that if this kind of thing was happening, it was an outrage. We needed to stop it. So the Children's Dental Health Project really works on creating policy opportunities and providing technical assistance so that care is available and accessible and affordable for families. So there are a lot of great organizations that are doing direct care. They're working with parents, they're educating them, they're making sure kids get services. We want to make sure the infrastructure is there, that the systems are there, and that there is a buy-in by levels of government, by anybody who can invest in it, in making sure that good oral health care is available. For the first time, instead of declaring health the condition of, the rest of the body, it actually includes oral health. Because if your mouth isn't healthy, you don't have health. And that's the point that we've been trying to make, because that's where policymakers buy in and they start to realize, okay, if we have these separate systems always and oral health is seen as less essential, we're not going to get good outcomes. If we don't get good outcomes, we're not only going to have people suffering and not reaching their potential, we're going to waste a lot of money. So why would we do that? Let's go ahead and have policies, practices, regulations that include oral health as essential to all health.